Hi friends, welcome to the channel The Nurse. Here we are discussing about medical and surgical nursing questions and answers. In that, we are discussing body defense mechanisms. You can also watch our medical and surgical nursing playlist, so you will get more question and answers. So question starts now. Before that, if you are not subscribed to our channel, please subscribe. First question. In stress, the sympathetic adrenal mechanism is activated and it is achieved through. In stress, the sympathetic adrenal mechanism is activated and it is achieved through thyroid hormone, epinephrine and norepinephrine, mast cells, B lymphocytes. The correct answer is epinephrine and norepinephrine. To achieve sympathetic adrenergic mechanism, the adrenergic fibers of the autonomic nervous system are stimulated to produce chemicals epinephrine and norepinephrine by adrenal medulla. These chemicals are responsible for fight or flight mechanism. To achieve sympathetic adrenergic mechanism, the adrenergic fibers of the autonomous nervous system are stimulated to produce chemicals epinephrine and norepinephrine by adrenal medulla. These chemicals are responsible for fight or flight mechanism. Next question. Which type of shock occurs due to failure of the heart to pump? Which type of shock occurs due to failure of the heart to pump? Hypovolemic, cardiogenic, septic, neurogenic. The correct answer is cardiogenic shock. Cardiogenic shock is caused by failure of the heart to pump an adequate amount of blood to the vital organs. Cardiogenic shock is caused by failure of the heart to pump an adequate amount of blood to the vital organs. This reduction in cardiac output means that the amount of blood that reaches the vital organs is not adequate for tissue perfusion. The reduction in cardiac output means that the amount of blood that reaches the vital organs is not adequate for tissue perfusion. Next question. The causes of neurogenic shock may include all except. The causes of neurogenic shock may include all of the following except spinal anesthesia, surgery, psychic trauma, pulmonary embolism. The correct answer is pulmonary embolism. Neurogenic shock may be caused by spinal anesthesia, surgery and drugs that inhibit sympathetic nervous system and psychic trauma such as fear, worry and emotional tension. Neurogenic shock may be caused by spinal anesthesia, surgery and drugs that inhibit sympathetic nervous system and psychic trauma such as fear, worry and emotional tension. Next question. An inflammatory response to a pathogenic organism is termed as. An inflammatory response to a pathogenic organism is termed as inflammation, allergy, infection, anaphylaxis. The correct answer is infection. Next question. If bacteria spread from local site into the bloodstream is known as. If bacteria spread from local site into the bloodstream is known as bacteremia, septicemia, secondary infection, toxins. The correct answer is bacteremia. Bacteria spread from local site into bloodstream is known as bacteremia. Bacteria spread from local site into the bloodstream is known as bacteremia, where when bacteria are present, growing and producing toxin into the bloodstream, the infection is called septicemia. When bacteria are present, growing and producing toxin into the bloodstream, the infection is called septicemia. Next question. Which of the following is not a factor of influencing inflammation? Which of the following is not a factor influencing inflammation? Age, sex, nutrition, adequacy of blood supply. The correct answer is sex. Factors influencing inflammation: age, nutrition, adequacy of blood supply, availability of WBC, that is white blood count, white blood cells, immune response, hormonal influence. Factors influencing inflammation are age, nutrition, adequacy of blood supply, availability of white blood cells, immune response, hormonal influence. Next question. What is the full form of TIGH? TIGH. Time incidence goal and hormone, total intake of growth hormone, tetanus immunoglobulin human, none of these. The correct answer is tetanus immunoglobulin human. Tetanus immunoglobulin human or TIGH. Non-immunized persons are started on a tetanus immunization series and also given TIGH. Non-immunized persons are started on a tetanus immunization series and also given TIGH. TIGH is administered intramuscularly in high doses. Part of the dose may infiltrate around the wound. TIGH is administered intramuscularly in high doses. Part of the dose may infiltrate around the wound. Next question. What is the other name of gas gangrene? What is the other name of gas gangrene? Septicemia, candidiasis, diabetic foot, clostridial myositis. Correct answer, clostridial myositis. Next question. An infection that involves the soft tissue of the fingertip is called. An infection that involves the soft tissue of the fingertip is called Pyronychia, Phelon, tendon sheath infection, lymphangitis. The correct answer is Phelon. An infection involving the soft tissues around and underneath the nail is called pyronychia. An infection involving the soft tissues around and underneath the nail is called pyronychia. An infection that involves the soft tissue of the fingertip is called Phelon. That is a difference. Next question. The type of cells are those which constantly multiply throughout life and replacing those cells being destroyed. The type of cells are those which constantly multiply throughout life, replacing those cells being destroyed. Labile cells, stable cells, permanent cells, bone cells. The correct answer is labile cells. Labile cells, cells of the skins and mucous membrane, blood cells are examples of labile cells that are constantly multiply throughout the life. Next is stable cells. The cells do not multiply vigorously throughout the life but do so if injured and if an underlying structure present. The cells do not multiply vigorously throughout life but do so if injured and if an underlying structure present. Examples are osteoblasts and functional cells of glandular organs. Examples are osteoblasts and functional cells of glandular organs. Next is permanent cells. These cells are unable to regenerate and in which repair is by scar tissue. The permanent cells are unable to regenerate and in which repair is by scar tissue. Examples: muscle cells, nerve cells of CNS, cell bodies of peripheral nerves. Next question. Which of the following factor is not affecting the healing process? Which of the following factor is not affecting the healing process? Color of the skin, age, foreign bodies, hormonal influence. The correct answer is color of the skin. Factors that affect healing are age, nutrition, adequate blood supply, foreign bodies, hormonal influence. Factors that affect healing are age, nutrition, adequate blood supply, foreign bodies, hormonal influence. Next question. A substance that when introduced into an animal elicits The formation of specific antibodies is known as a substance that when introduced into an animal elicits the formation of a specific antibodies is known as foreign body, antigen, antibody, immunity. The correct answer is antigen. Next question. Which type of immunoglobulin consists 75% to 85% in blood? Which type of immunoglobulin consists 75 to 85% in blood? IgA, IgG, IgM, IgE. The correct answer is IgG. Next question. Which immunoglobulin is known as macroglobulin? Which immunoglobulin is known as macroglobulin? IgA, IgG, IgM, IgD. Correct answer is IgM. IgM is a large molecule and is often called as macroglobulin because of its size confined to the blood, where it is mainly involved in providing protection against bacterial and viral invaders. IgM is a large molecule and is often called the macroglobulin because of its size confined to the blood, where it is mainly involved in providing protection against bacterial and viral invaders. Next question. Why gamma globulin preparation is not administered through intravenously? Why gamma globulin preparation is not administered through intravenously? Not effective, large quantity, thick preparation, causes severe anaphylactic reaction. The correct answer is it causes severe anaphylactic reaction. The isolated gamma globulin preparations tend to form small protein aggregates, and this, if injected intravenously, could lead to severe anaphylactic reactions. For this reason, the material is always administered intramuscularly. The isolated gamma globulin preparations tend to form a small protein aggregates, and this, if injected intravenously, could lead to severe anaphylactic reactions. For this reason, the material is always administered intramuscularly. Next question. Which one of the following is not included in 4 classical signs of inflammation? Which one of the following is not included in 4 classical signs of inflammation? Calor, rubor, callus, tumor. The correct answer is callus. 4 classical signs of inflammation includes calor, that means heat, rubor, that is for redness, dolor, that is for pain, tumor, that is swelling. 4 classical signs of inflammation includes calor, rubor, dolor and tumor. Next question. Which of the following is a type of isolation consists plastic tent that completely shields the patient from environment? Which of the following is a type of isolation consists of plastic tent that completely shields the patients from environment? Positive isolation, reverse isolation, life island, laminar airflow room. The correct answer is life island. Life island. In the life island isolation, the air inside the tent is filtered and sterilized articles are passed to the patient through portholes irradiated by ultraviolet light. In the life island isolation, the air inside the tent is filtered and sterilized articles are passed to the patient through portholes irradiated by UV light. Patient contact is through arm-length gloves built in the sides of the tent. Patient contact is through arm-length gloves built in the sides of the tent. Next question. Which of the following is a wrong statement about Clostridium tetani? Which of the following is a wrong statement about Clostridium tetani? It is a gram-positive bacteria. It is an anaerobic bacteria. It is a comma-shaped bacteria. It is a spore-forming bacteria. The correct answer is it is a comma-shaped bacteria. That is a wrong statement because Clostridium tetani is rod-shaped bacteria. Next question. The characteristic smile present in the tetanus due to the stiffness of neck and spasm of facial muscle is known as. The characteristic smile present in tetanus due to the stiffness of neck and spasm of the facial muscle is known as opisthotonus, rhizus sardonicus, lockjaw, moon face. The correct answer is rhizus sardonicus. Next question. The secondary response of the antibodies against the same antigen is termed as. The secondary response of the antibodies against the same antigen is termed as anaphylactic reaction, allergy, immune response, anamnestic response. The correct answer is anamnestic response. The secondary response or anamnestic response or remembered response is a characteristic of both B and T cells system. The prior contact with the antigen is stored in special memory cells of the both cells line. The secondary response or anamnestic response or remembered response is a characteristic of both B and T cell system. The prior contact with the antigen is stored in a special memory cells of both cells line. Next question. Tuberculin reaction is an example of. Tuberculin reaction is an example of anaphylactic reaction, cell-mediated reaction, cytotoxic reaction, immune complex reaction. The correct answer is cell-mediated reaction. Next question. Large amount of the citrated blood given over a short period of time causes. Large amount of the citrated blood given over a short period of time causes hyponatremia, hyperkalemia, hypocalcemia, hypercalcemia. The correct answer is hypocalcemia. Each unit of PRB's packed red blood cells or FFP contains approximately 3 grams of citrate used as a preservative and anticoagulant. It binds with serum calcium and leads to hypocalcemia. Each unit of PRBC or FFP contains approximately 3 grams of citrate used as a preservative and anticoagulant. It binds with serum calcium and leads to hypocalcemia. Next question. Transplant rejection is an example of. Transplant rejection is an example of type 1 hypersensitivity, type 2 hypersensitivity, type 4 hypersensitivity, type 3 hypersensitivity. The correct answer is type 4 hypersensitivity. So questions ends here. Thank you for watching this video. Please like and share this video and don't forget to subscribe our channel, The Nurse. Thank you.